September. So we have funding for free school meal provision during the summer holiday, as well as providing the financial support to families on a referral basis that we undertake at the moment. And Colin and his team are having conversations with schools around the education recovery. Now, clearly, it's not a political statement to say that the government's plans around education recovery didn't really land to the full extent that I think they initially thought they would with regard to funding. So we're seeing what we can do locally to support the recovery of children, given the amount of time that they have lost to their education. In children's services, pretty much as we have reported previously, we continue to see increases in demand, more children being referred in more complex circumstances. Overall, our performance continues to be good, but our capacity is very stretched, and caseloads for a number of our social workers are higher than I am comfortable with at the moment. And as reported previously, mental health for children and young people continues to be a factor in the referrals that we're seeing. We are doing some cross-service work around self-harming. We are seeing more children reported to social care because of self-harming. There's clearly a pandemic factor there, and we want to explore the pathways and the support that's available for those young people. And also corporately, Safe Lives, a voluntary sector organisation, have just reviewed our arrangements for domestic violence, and we are taking forward those recommendations on a multi-agency basis because we have seen an increase in domestic violence being reported as we reported to the last committee meeting. In regard to care providers, we provide extensive support, as we've informed the committee previously. We continue to have a very low level of outbreaks and infection in care homes, despite the local increases we've seen over the last few weeks. There is intense pressure to hit the targets of 80% of staff in care homes being vaccinated and 90% of residents. We have the emails virtually on a daily basis asking what's happening around individual homes. Some good work is happening with and in homes to encourage vaccination. Some homes are a bit stuck, but I think we are assured that they are doing everything they can to persuade particularly groups of staff to be vaccinated. And of course, the government has announced its intention to make vaccination mandatory for all staff working in care homes later in the year. And when I say staff working in care homes, that applies to anybody working in care homes. It can be the local plumber, it can be the hairdresser, as well as the staff who are directly employed by the home itself. And as you can see, we're currently at 79% of care home staff and 90.6% of residents. So I think we might just have passed the 80% mark, the target for staff, but we do have some homes that are below the level at the moment. And then with regard to priorities, these are pretty much unchanged from your previous meeting. It is continuing to do everything that we can to support our colleagues in the NHS with the vaccination programme and encouraging individuals and communities to be vaccinated. As I said, also to continue to work to improve the take-up levels of vaccination in care homes in particular. Our colleagues in the NHS are under considerable pressure given the restart of functions that have been cancelled during the pandemic, and we have ongoing work to reduce the inequalities that COVID has exacerbated, as well as responding to the increased activity in children's social care that I had described earlier. And I think, as I usually end, continuing support to colleagues who are under an awful lot of pressure and are increasingly tired, given the challenges they're having to face on a daily basis. So I will conclude at that point, Chair, and I'm happy to take any questions.
Thank you, Adrian. It is very disappointing that the uptake is not as good as we wanted, and I think you know, I know that everyone involved in the COVID program is working extremely hard, and you know, I mean, one of the things that does upset me and annoy me, and I think we need to collectively you know, do our bit. And I think one of the things that I did think of was that maybe we need to the communities that are resistant to having the vaccinations, maybe we need to have a few more examples of where people have had something terrible happen, to actually put them up as case, something virtual. I know the schools are doing an awful lot. We need to sort of have champions of people that have realised how vital it is to have the vaccination to save their loved ones, save their friends and families. And I think, I appreciate there is an awful lot that everyone's doing, but I think, people have to take responsibility as well. And I think, I've heard of 1 or 2 cases where people have, when it's happened to somebody close to them, they suddenly realised, it's best to have, get yourself vaccinated, and then they've sort of scurried over to the centres. So I think, I don't know if there's anything along those lines already happening.
There is quite a lot going on around communications, including sort of trying to inform communities of the consequences. I think generally we've been trying to get people on a sort of more positive message. And I know, for example, we had some real success a couple of weeks ago with the Roma community in the borough around getting a couple of community leaders to really share that message and enabling that community to be vaccinated quickly. But I can see Gladys's camera has come on, so I think she might want to come in at this point.
Yeah. Thank you, Councillor Farrar. We have been doing quite a lot of engagement work. I think at the moment what we are finding is originally when we started there was a lot of vaccine hesitancy, but that's now shifting. So like you said about somebody who recovered from COVID to come and talk to them, we have got somebody who recovered to come and talk to community groups. So we're actually targeting, we get data every day, so we can see by where the uptake rate is lower. And we're targeting people, and also now we're concentrating more on the younger group. So we're going to be doing quite a lot of work with the 18, returning university students, those who are in education. So we've got a big program, but we review that every week and change it according to what we have to do. We've got also a lot of our GP colleagues are doing videos, and it's really because we can see it, because we look at our trends every week. And the work we are doing, we can see it making a difference in the last 4 weeks.
I would also say, Chair, that if members have got any ideas, they've spotted areas of the community that are hesitant or not coming forward, or they think we're missing a trick with regard to getting at members of the community, then please just let us know. And we take all advice very gratefully at the moment.
Councillor Noor.
Chair, thank you. Adrian, thank you for your report as always, and also Gladys for your wonderful work you're doing. But having said that, the report presented mixed messages in terms of the COVID situation. And I want to ask the question, a specific question regarding your second slides, that according to the statistics as presented, the COVID positive rate has been increased in Brazilian Red Bridge, especially you mentioned Seven Kings where I live, and neighboring ward is Newbury. But in this scenario, we understand that government is already made decision to take all kinds of restrictions away from 19th of July. I understand if we stand as it is. And how confident you are, or how concerned you are in terms of, one hand, the COVID infection rate has been increased, on the other hand, government trying to wipe their hands that you can do whatever you want to do, that less people die. Do you think that you are concerned on this matter, and what we as a local authority can do locally to save our community members? And second thing is, I just to in terms of the vaccine hesitancy, my personal observation is, I remember that beginning of this pandemic, I was one of the person that was talking about that we need to engage our community. But I can feel and see now that our community, especially Muslim, Asian community, Bengali community, they're coming forward. There is generally there is a high tendency and really appreciation for this vaccine vaccination. So I think so there's a more room to be done, but I think so this is going to the positive direction. Thank you, Adrian, and thank you, Gladys.
Thank you. I agree completely, Councillor Noor, and I think Gladys said we are seeing that shift in terms of attitudes towards vaccination, particularly in older members of the community. What we need to now do is shift our approach so that essentially we are attracting younger people, because as we know, younger people can often have a different form of motivation to older people. So we just want to change the comms to attract people. To essentially to ensure that everybody does get vaccinated, because it's quite clear that with the changes that were announced yesterday, it's very much vaccination is at the absolute forefront of the effort to combat COVID. We will be considering our messaging locally. We think that it's still, well, as the Prime Minister and Secretary of State says, it's still incumbent on individuals to act responsibly. And I think there's some messages that we really need to put out as a local authority with regard to the need to continue to do that, because actually a number of the measures we take to protect others rather than necessarily ourselves, and that's really important that message continues. The rate of increase in the level of infection is a concern. As I said, we aren't seeing a similar level of hospitalisation. But getting COVID is not good news for anybody, and we will continue to seek to reduce the level of infection within the borough as we can. I would say, and I was testing out with Gladys today, what we are seeing with regard to infection in terms of the distribution around the borough, essentially we're tending to see infection in household units. So if one person in the house is infected, the rest of the family tends to be infected, which is why the position tends to change by ward reasonably quickly, because we're reflecting that infection within those units rather than the more general population. And I think Gladys is nodding, so I think I've still got that right.
You did, yeah.
Thank
it's
you.
In family setting, not in other settings.
Councillor Hatfield.
Thank you. Certainly in my ward in the last week, 10 days, I've heard of a lot of people who have either tested positive or been ill with COVID. I know that's not official data, but there certainly is an increase. Mainly, again, it is the young adults who are bringing it into the house, and then the whole house is later testing positive. Thankfully, all but one case, they've been quite mild. There's only one case where I know it's been severe, and that was someone who had not got a vaccine. So I do think the vaccines on the whole are working, not stopping it, but keeping people out of hospital. With regard to what more we can do, I don't know, because there's people out there who have not got vaccinated, who are intelligent, who are widely read, and yet they're still making the choice that I'm not having a vaccine. And I don't think the council telling them is going to change their mind. I think they've made their mind up, and I think it's going to be very difficult. And that worries me. I'm also worried about with the care homes that 79–80% vaccination of staff, as they were offered it very early. And I am worried that 20% who haven't got a vaccine will not have a vaccine, because if they were going to have one, they would have had it by now. And I do worry, in a sector where there are chronic vacancies, where there's a lot of agency cover, where it's hard work, low pay, shift work, long hours, I do worry when it becomes compulsory whether that will make some of the staff get vaccinated or whether they'll just leave. Because, if it was an easy decision for them, I think they would have done it straight away. The fact they still haven't, I am worried that it could further exacerbate staff leaving in care homes. And I really, really do worry about that, when the sector has no real spare capacity and care homes routinely are stretched through being unable to get staff.
I think, Councillor, we very much share that concern. We are having conversations around what we can do to support the sector with regard to recruitment. We have seen a slight improvement in the situation with following the announcement towards mandatory vaccination. I think the one thing I would share is that actually the take up in care homes is quite lumpy. So we've got lots of homes which are 95, 100%, and we've got a few homes that are struggling around 60 or 70%. And it seems to be where we have almost groups of staff who are reinforcing each other's views towards the pandemic. So, but we have seen movement in some of those homes and some of those groups. So we will continue to work with the managers, and I think all credit to the managers of the homes. They are doing everything they can to persuade staff and residents to be vaccinated. It's just a long journey, but I think we will just continue that effort with them. So we are seeing movement in respect of attitudes toward vaccination in care homes, which is positive.
Councillor Mrs. Nolan.
Thank you, Chair. That was one of the questions I was going to raise with Adrian about the concerns about the care homes. With the staff, if it becomes mandatory, they'll refuse and just leave, and it's not an area that's highly paid or valued. So that's one worry I have. But I was going to ask you, Adrian, there's a lot of concern about the long COVID as well. And I just wondered, have we seen any evidence of that in Redbridge as to whether that's actually happening here as well? And there's also evidence of individuals that have had both vaccinations that are actually catching the virus as well. So I just wondered if we had any evidence of that in Redbridge at all.
Well, on the latter point, both vaccinations do not give you immunity. They reduce the transmission and they reduce the severity of COVID, but it doesn't give you the absolute immunity, which is why we still need to be careful. I know Gladys wants to come in on the question of long COVID.
Yeah, thank you, Chair. Thank you, Adrian. So we do know, because ONS published some data, self-reported. There's about 1 million people who they consider them to have had long COVID. So NICE produce some guidance on, because long COVID has got to be diagnosed, because normally when you recover from a viral illness, you have what you call a viral syndrome. So that's very sort of temporary. But this is something very, very different in severity as well. So we have got a long COVID clinic at King George Hospital for the 3 boroughs at BHR. So that was opened about, I think about eight weeks ago. So what we are now doing is encouraging people who think they have had long COVID to go to their doctors. So before you are referred to the clinic, you have to have quite a few tests before you go in, like blood tests, chest x-rays, and then they're referred to the specialist in the hospital. Then they will follow them up, because about 2% will have what we call long-term health conditions. And then at the lower level, people will have other conditions, probably because they probably might need to do some exercises. So it's so everyone has got to be assessed and followed up. Not everything is clinical. So so what we are doing at the moment, working with the COVID clinic staff to see whether we can have a pathway, because we have got an exercise and referral scheme with Vision. So we want to see whether we can commission something similar across the 3 boroughs for our residents. So I am waiting for numbers from Redbridge, but so far I know they have had 94 referrals to the clinic in the last 2 months, but across the 3 boroughs. So I think Adrian and I were discussing it yesterday. I think we would like to see some data by age, ethnicity. We need some details. And I think the next step would be, we would have some comms around, if people think they have, please go and see your GP and get yourself referred, because that's my main concern as well. One of the reasons I said we are really, really trying to encourage younger people to get vaccinated, because the long COVID is effective, because young people think, I'll get over it, but there is really good evidence now to see that they are the ones that are left with long-term effect of COVID.
Thank you, Gladys. And that was going to make a question is about the data as well. It would be interesting to see what kind of age groups this is affecting. And it's interesting what you said about the youngsters, that it seems to be affecting them more. So all the more reason why we need to get them vaccinated and as quickly as possible, particularly now that they'll be back from universities and so on. Yeah. Thank you very much, Gladys. Thank you.
Councillor Jones.
Yeah, thank you, Chair. My first question was probably touched upon by other colleagues is basically if we have any data that indicates what age groups are being infected with the Delta variant at this stage of the vaccination cycle, and what possible measures could we encourage with the community as the lockdown restrictions are ended, you know, possibly in July, or because it's looking likely that the third wave doesn't seem to be ending anytime soon. So is there any advice we could give to the community as to what kind of safety precautions that they could take to keep themselves safe?
I know Gladys will come in. I think, Councillor Jones, virtually all infections at the moment are of the Delta variant. It is the dominant variant in Redbridge by far, as it is indeed nationally. And we know it's more infectious and it's more transmissible. With regard to advice, I think the first thing we need to do is, continue to give the very strong advice that if you have symptoms, if you've had a positive test, you must isolate. I know there are changes coming up through government, but it continues to be the case that it's so important that people who test positive isolate. And then, it really is for people to be sensible and to take sensible measures when it comes to protecting themselves and others. I do accept, not everybody is sensible in their behaviour, unfortunately, and we will continue to, I think, increasingly target the messaging to around particular segments of the population with that regard. But Gladys, do you want to say anything?
Yeah, I think Councillor Jones asked about the age group.
Yes.
At the moment, it's affecting the 11 to 29 onwards. So it's the younger age group. So they're the ones in school, but the transmission is not happening in schools. It's happening in the community. So that's why one of the reasons why we are trying to get the younger group vaccinated. So we know over 60s, the numbers are coming down, over 80s down, is the younger age group, under 40s. Mainly predominantly 19 to 24.
Yes. I think you're on mute, Chair.
Sorry, I knew I was going to get called like that. Cabinet members, do you wish to add anything?
Sorry, I think Bob's got his hand up.
Yeah, I did have my hand up. I took it down because I was raising exactly the same points as Councillor Nolan. Thank you. So I don't need to say anything more.
Councillor Santos, did you want to say anything?
Only that, only just to echo what's been already said, in the sense that the key aspect of our strategy is vaccines and getting people vaccinated, and there's been lots of creative and innovative ways of trying to connect with people from different communities and different age groups and still coming up with ideas to reach them and to get people vaccinated, and just to say that the government's messaging and the government's change I think is unhelpful, because they're just talking about vaccination, and clearly that's a key part of the strategy. But our strategy is what you describe as combination prevention, and includes different aspects and different messaging. You don't hear government ministers anymore talking about the need for testing and self-isolating, and there's a real mixed message, if you heard over the weekend, about the use of face coverings. And what we will be doing is we will be messaging using combination prevention messaging around all of those ways, because as Councillor Noor asked about how we would be attempting to reduce or mitigate the growth which we're going to see. The Prime Minister said 50,000, didn't he, by the 19th? And I think the Secretary of State for Health said 100,000 cases. So we are going to see a rise in cases, but what we want to do our best in Redbridge, where we've been hit really hard and lost too many people, is to have that broad range of other messaging, just to help people just to help reduce the impact, because it isn't like flu. It really isn't. It's more transmissible and it's more virulent. And we have the issue that Councillor Mrs. Nolan raised about the concern about long COVID. which I think and I think Gladys hinted at, is that we don't know a great deal about the impacts of that. There was those of you who read New Scientist, a couple of weeks ago, there was a good set of articles in there about long COVID, which I would refer people to. But it's certainly something that's very new, and so it isn't. So COVID is something we want to avoid to acquire, and we will do our best, and I know all of you will do your best in terms of the messaging to avoid people contracting COVID. And yeah, that's really what I wanted to say, other than a huge thank you to Gladys, Adrian, and the team, who are just they're having to work relentlessly. It doesn't stop for them, and there's the whole this is, I'm not trying to make a political point, but the changes then have a whole heap of new guidance that just get dumped on people to try and interpret quite almost overnight as well. So I really want to say a big thank you to the team and in the education, and all who are also working really hard to keep us safe and to keep things going. So anyway, enough from me already.
Thank you. Can we agree to note the presentation and the comments? And from us, thank you, Adrian, and your team for all the hard work.
Chair, I had a
that you
question
do.
actually.
Oh, sorry, Councillor Ahmed, I didn't see your hand up.
No, since you've moved on, I'll just very quickly point out, I would echo Mark's, thank you to everyone who's involved and doing really trying really creative ways of moving forward. Just one point to add, since this virus, the variants will keep coming, and there will be new mutations, and there will be new viruses surfacing every now and then. Will there be a policy or a strategy in place to keep continuing doing bits and pieces that is working wide range, so that we can actually keep that awareness building going and the campaign for this vaccination and everything, such as activities such as pop-up clinic and those kind of things? Is that something that we can continue to do? That's all. Thank you.
Yes, absolutely, and I think you've already heard that we're planning is started for the third dose over the next few months. So, and we will continue to explore what works and testing. Some things won't work, but we'll learn from experience as to how we best vaccinate people. But Gladys, did you want to?
Absolutely, that's exactly what we meant to say, because we've already started planning. So we started for the flu program. We start in July. So similarly, we already are starting for the what we are calling the booster dose for COVID. So everyone over the age of 50 will be offered the flu vaccine and the COVID vaccine at the same time. So we're working, I think, local pharmacies as well, whether they could be delivered. So when you go, they will. So everyone over 50, anyone under 50 who's got underlying medical conditions, so they'll have the flu in one arm and the COVID in the other. So there's lots of trials that have already happened, and it's really effective. So we will start that. So we're already planning and keeping the momentum going. Thank you for that.
Thank you. Thank you.
Thank you. Thank you all very much for that. Thank you. If there's no other comments, we'll move on to agenda item 7. Local Authority Youth Service Provision, agenda pages 9 to 19. I think we've got the Operational Director of Education and Inclusion, Colin Stewart. Over to you, Colin.
Evening, Chair. Evening, everybody. I'll give you just, I know you'll have had the opportunity to read through the paper, so you'll pick the detail up from that, but just effectively summarise. The report gives you an overview of the current arrangements within the youth service, how it's structured, what our current capacity is and what the current offer is to young people. And you'll see from the report that the youth services effectively shifted from a universal open access to a targeted service for vulnerable young people over a period of time. And you'll also pick up from that the services effectively had to continue to diversify. So we've looked at areas like, for example, how we support the Year 11 Pupil Referral Unit programme, which is based at Hainault Youth Centre during the day. The service is diversified into additional support for young carers, and it's also done some intervention work. So it starts to get involved at almost, if you like, a case level in terms of actually interaction with specific named young people, and to try to effectively divert them away from potentially negative impacts of things either in their own lives or around them in the community. I think, although the report sets out obviously within it short-term priorities and next steps for the service, I think what I just want to, I guess, reflect for members, because it's not in the report, is that clearly what we're now in the middle of doing is actually focusing on what youth service provision might look like in the future, thinking in particular about our experiences and the impact of the pandemic and how that's affected the way in which we deliver services and how that's affected young people. You'll know yourselves, and you've just been talking about it, that COVID has impacted every section of every community within the borough. And for young people, it was no different. It did show us some things about young people. I think part of it was about young people's resilience and ability to respond sometimes to difficulties. But equally, the other side of that was their vulnerabilities. And what I think we've picked up from the work that the youth service have done through the pandemic with young people is their need for an increasingly diverse and yet bespoke set of support arrangements, which has got the flexibility to adapt to individual circumstances or changing needs. And that's a challenge for us going forward, in the sense that how do we develop a new approach? We recognise that actually youth work has got a critical role to play as a catalyst in young people's lives and as a positive lever for change and for good. And yet at the same time, we've got to try to structure that service in a way in which it will not only impact on young people, but it will do it within what are limited resources. And we've set out within the paper the shift in terms of how youth services are funded, and we've moved away from ring fence to part of the general budget and so on. I just wanted to kind of share with you, I think, some of our early thinking about what we think that might look like in terms of what that kind of future of youth service work might consist of. So we're talking about how we increasingly integrate the work of the youth service in along with the work of others, and we've already started to do that. As I say, these examples about what we've done at Year 11, what we're doing in terms of how we support targeted work at an individual case level. I think we're keen to exploit, I think, the opportunity to, I guess, if you like, deliver and adapt existing environments, both outdoor and indoor, actually to be suitable for young people and for youth work to take place in. So kind of, if you like, moving away from the traditional idea of the youth centre, which is a place that people go to, and a much more bespoke and diversified offer of lots of different places that young people can use for access, both whether they're working independently of youth staff or whether they're working with staff. And you'll know, for example, about the Council's Community Hubs programme and about how we plan to use that from a youth perspective when that starts to come on stream. I think we're clear about the fact that actually what the pandemic highlights for us, as it does in all facets of working with young people, is that we've got to keep developing the workforce's skills. And we've partly in the short term got to do that by reflecting what the workforce is going to need to respond to the impact of the pandemic in young people. And I know that my colleague's going to talk to you about education, well-being, and about the work we're doing to support young people's mental health in a minute. I think that we're clear in Redbridge that one of the, what I'll call jewels in the youth service offer at the moment is the engagement and how we access the voice of young people in Redbridge, and we're clear that we want to maintain that. But there are, I think, three kind of wider agendas that we know that the youth service work has got to contribute to, and we've got to get it meshed into that going forward. The first one is the council's programme in terms of being environmentally sustainable and the green agenda, and we've got to think about how we build young people into that process, both in terms of their thinking but also their activity and their engagement and their activism through that. The second one is actually what the pandemic has flagged up for us would be the considerable challenge that we face in Redbridge about the digital divide. and the potential impact of that digital divide. And so we're clear that in the same way that schools have got to contribute to that and the council's got to contribute to that, we do see that the youth service role in the future is partly thinking about how can youth work contribute to bridging some of that digital divide that young people experience. And the third bit, because it sits very much at the heart of the education recovery for young people, is that as much as we want education and learning to recover, a critical part of recovery, whether we're doing it in schools or we're doing it outside of schools, is about young people's mental health and well-being. And so what we've now got to think about for the youth service moving forward is about how it continues to support on those three different core priorities, I guess, that the council's got on a broader basis, so that we make sure young people's voice is at the heart of it, but also that young people are beneficiaries of that work that the council's doing. I'm going to stop there, because that kind of covers, I guess, all the things that we want to talk about. My colleague Chris, who's the head of service that covers the youth services available, because as you would expect, I'm the kind of person, I don't know any of the technical detail, I don't know any of the detailed answers. So yeah, I'll let Chris deal with the technical stuff, but we're happy to take any comments or any questions.
Thank you, Colin. One of the things that I was just looking at the under 6.6, it's saying that the youth offending and targeted prevention service and reoffending rate is downward. What period are we talking about? Is that last year or in previous years? Where's the downward trend? When did it start going down?
Shall I take that question? Yeah. Hi, Chair. The reoffending rate is being calculated. The journey of those young people first offend, we measure that, follow the journey for minimum of 18 months. So basically, the statistics would be showing that how many proportion of those young people in the particular cohort of 2 years ago. Yeah. So all the statistics are historical data. So when we, for example, when I get the data this quarter, it will show about 2 years ago what happened and how many young people 2 years ago they offended, and then within the period they reoffended. So we capture the data for the last 2 years, and that reoffending trend is going downwards. It's less young people year on year. Within the counting period, they reoffend again. So that's how it's measured.
Right. Okay. Okay. If I may, can I also pick up on 7.4, the external scrutiny panel that was set up? There doesn't seem. I mean, I don't recall seeing very much coming out of it. Is that something that we're going to perhaps try and set up an external panel for young people? Is that something that we hope to do, or what's your thoughts, Colin?
So what happened effectively, Chair, is that the external scrutiny panel met with the Youth Council. And what they talked about was a series of priorities that young people had that they would endorse and support the council working on. So effectively, those priorities have been shared. Some of them are stuff that education's got to do, but some of them are stuff that might be getting done by children's social care, by housing, by community safety, and so on. So lots of different people across the council are now working to address those priorities that young people set in conjunction in their meeting with the external scrutiny. And then what will effectively happen is that we do regular updates on those, so those come back to us. And then at the end of the 12-month period over which we tackle those priorities, you effectively bring the external scrutiny panel back together and effectively review the progress and the impact on the priorities that you've had during that 12-month period. So that's roughly how it worked, how it originated, and how we think the kind of review of it will work.
Okay. Okay. All right.
Through you, Chair, may I just add that the external scrutiny panel has an annual commitment to meeting with the Youth Parliament every year, and that stands for this year too.
Oh, okay. Thanks, Carol. Thank you. Councillor Jerry Ranjan.
Thanks, Chair. my brief comment on this, it is satisfying to note that even though the number of youth centers we have left is much smaller, lots of work is being done in engaging young people. Very good to note this. My question is, page number 14, under achievements of children in care councils, it says all year 10 and 11 will get laptops. Is it to keep or just a loan?
Chair, my understanding is that those laptops are for the young people who are looked after children, and that are being provided for them to keep for their learning, making sure that they would have the facilities and equipment to engage with their social worker, to engage with their friends, at the same time would be able to participate in online activities, and more important is they have got the equipment to do their learning if they're not at school.
And
That's
Chris,
right, Chair.
my understanding is that corporate parenting, we agreed that they would keep them in perpetuity, which I think was the specific question. Right.
I think that's right, Councillor Adams. They do keep the piece of kit that they're given in perpetuity. In addition to that, the council's actually funding 1,000 laptops for young people who are not in care, and has applied the same principle to those too. So effectively, they are currently being donated to disadvantaged young people who experience challenges with digital divide. They will go to those young people. We provide support to them, and we will effectively support them to maintain that. And in actual fact, what we're currently starting work on with the schools is actually, once we've done all of that and we've got these laptops out to, for example, children in care or vulnerable young people in schools, of course, the key thing would be, at the moment, this issue is going to come up again next year and the year after as new groups of children emerge. And so what we're now looking at is how do we mainstream this to become a part of the offer within Redbridge to young people to try to mitigate any impact of the digital divide? Because we were just talking this morning about the fact that one of the things that's come out of the pandemic is how good the schools have been about creating mechanisms for remote learning. The problem is that in order to access remote learning, you've got to have the kit and the facilities in order to benefit from it. So it's we think that remote learning is going to be a part of educational provision into the future. So we know we've got to mainstream this, but you are right, they're going to be retained in perpetuity by the young people.
Thank you.
Thanks. Can I have Councillor Hatfield?
Thank you. I do think with the budget, youth services is doing an incredible amount in Redbridge. I am worried with the targeted access, although it's the right way forward, that of those people who just fall outside that group. And certainly in my ward, there's lots of families who work very long hours on low wages, and the young adults are left to their own devices. And I do worry about that group, and particularly they don't get the help they need, and what more we can do with that. My points, 2 points. Was at one time, were we going to do a task and finish group on youth services, or have I just imagined that, which is quite possible? If so, it might be worth spending a bit of time looking at them. And secondly, I was wondering whether we could do some visits. Maybe not now, maybe when things were a bit more back to normal after COVID. So maybe, I don't know, next spring sometime, where we could go to Loxford. Actually, Loxford would be quite good, because if the Prue has moved there, or even if it hasn't, we can see how things are working. Maybe go to Hainault and actually do some visits. I think would be useful to see how it's operating face to face. I still don't understand why some of them, and there's probably historic reasons, are under Vision and some of them are under the council. And I do think that must make it quite hard to manage as a service. I do wonder if maybe it might be worth bringing them all together. But yeah, those are my concerns. It's mainly those people who just miss out the targeted provision. And yeah, I do think it would be useful to do some visits and see face to face how the services are operating once they're a bit more back to normal, hopefully probably in the spring, or maybe late autumn.
what I can confirm, Councillor Hatfield, would be that actually you are right about the issue about the definition of what constitutes vulnerable. I think, again, that's something that we've learned from the pandemic, that actually, I guess what we previously would have used to determine vulnerable, actually we realise that actually there is a group of families who sit just above what would have been that archetypal way in which we judge that, and yet they face very similar challenges to other families who've got potentially more acute problems. So we are clear about that, and we're looking at how we extend that. That's part of the reason why we want to try to think about how we get a more diversified youth offer in more spaces, which becomes more about a kind of touch points for young people that they might want to come in and touch, rather than effectively we're going to have to spend a lot of time and put a lot of resource in to making something happen. So we are looking at how we extend that definition. It wasn't your imagination. We did agree that there would be a task and finish group, and we're working proposals for that. Our proposal on it is effectively going to say that we think that should be a joint task and finish group between People's Scrutiny and the Youth Cabinet to look at the future of the youth service. We think is a joint piece of work between members and young people. It's an ideal topic to do, and we'll draft that up for you and make those proposals, but that's our first thinking on that. And in terms of visits, I'm going to say yes. What I'm not going to commit myself to is when those visits might take place. I think you might be right. It might be the autumn, it might be the spring. I think we'll all kind of wait and see. But I think in principle, I think the service would welcome that, and I know that young people would want to engage, because I think young people are generally present really well at these things, and I think it's good for them and it's good for members to hear directly from them.
Thank you. Can I just, before I call anybody else in, whilst it just occurred to me that, have I missed it, but semi-supported housing for young people, how many do we place from Redbridge into these? I know they're private, they're not really, they're not overseen by Ofsted or anybody else. Is that something that I know they were popping up in my ward, and that was quite a concern for people, whether it was factual or whether it's assumed that they were up to no good, but they were going out early hours of the morning, and I just wondered how many do we within Redbridge place our young people into these semi-housing units that are privately run?
Chair, I can probably comment at that point. I think we tend to use that accommodation for our care leavers, so our over 18s. You can use that provision for 16 to 18s. We tend not to do that, except an example of some of our unaccompanied asylum seekers where we think they are old enough to be able to live more independently. We probably have, I estimate it's probably in the region of about 200 young people placed in semi-independent living. Most of those will be in Redbridge, others will be in other boroughs, but obviously we do have a large number of young people from other boroughs placed in semi-independent provision in Redbridge. We are doing some work across Barking, Dagenham, Havering and Redbridge to try and get a better understanding of who's placing and to share issues and concerns around the placements of other local authorities are making. And finally, Ofsted are bringing in measures, whilst they're not regulating this provision. I think that it is under increasing scrutiny, at the very least from the perspective of the inspection of the local authorities who are placing the young people in this provision and having to assure inspectors that it's sort of safe and appropriate accommodation for young people to be placed in. But you're absolutely right. At the moment, that provision sort of sits outside both the children's and the adults' inspection regimes.
Oh, that is a relief. I think it did need looking at. So I'm rather pleased to hear that it might come under Ofsted to look at local authorities' responsibilities for that. No,
Chair, if helpful, I could ask John Anthony to bring a paper to a future meeting of this committee around the use of semi-independent provision by Redbridge, if that'd be helpful.
That would be very helpful.
Okay,
thank you.
I'll do that.
Councillor Mrs. Nolan.
Yeah, thank you, Chair. I was wondering when we were going to be asked to speak, actually. It seemed like you were having your own little private meeting there with Colin. Yeah, thank you, Colin. What really does concern me a great deal is children's mental health. And that's something that I've actually raised. The chairman of Health and I have asked a report to come to Health Scrutiny, because it really does concern me about the number of children that have been at home, that maybe have been exposed to domestic abuse, and issues of safeguarding. So that really is something that I'm very, very strong about. And I think that that's something perhaps we need to focus on. But I was going to ask you about the decommissioning of the youth bus. When did that happen, Colin?
I'll let Chris pick up the details on
that.
that.
Right.
Yes,
Okay.
The youth bus, because of the age and the emission that is not complying with the current regulation of the OLAS. Yeah, so I think it was just before COVID, we actually put it at the depot.
Okay, I know we seem to have a very nice bus about COVID that goes around, so I just wondered if it had been adapted for that. The detached youth workers, they tend to meet young people on the streets and parks and so on at different locations through the borough. And you've got 5 detached youth work sessions a week. Where are they? Where are they located? In which wards? Sorry, the other thing I also wanted to raise was, sorry, Chris.
Sure.
Does Elmcroft Centre not have any youth provision anymore?
Sorry, Councillor.
The Elmcroft Centre in Wanstead, does that not have any youth provision anymore?
Oh, I see.
It's not been, there's nothing in the report to say that anything happens there at the moment.
The Elmcroft Centre, which is the Wanstead Youth Centre,
yes.
At the moment they are under the management of Vision LCL.
Okay.
And my understanding is they have, before COVID, I believe that they have got 2 sessions. One is run by their own staff. The other session is in partnership with external organisation.
Okay. It would have been nice to have that reported in the youth report, actually, Chris, because, you know, the focus is on Haynor and Oxford, but there's other things happening in other parts of the borough. So it would have been nice to have heard that, really.
Yeah,
I mean,
Councillor.
I only ask because I live right opposite, so I know it's happening and I know it's going on.
I do understand. I think after I reread the report, I think I made a mistake early on when I mentioned the vision. It should be talk about Oxford and Wanstead rather than Haynor. So I apologise for that.
No, Chris, that's fine. Thank you for the explanation. But so I just kind of wondered, you know, where the locations are in the borough that the youth workers go out and meet, obviously, the young people. I mean, we hear a lot about the stabbings recently with young people and so on, and it really does concern me that you know, they're kind of slipping through the net, some of our youngsters, really, because there isn't a lot for them to do. So
they tend to
where are they, Chris?
They tend to go to different places during the week, because I think when they're doing foot session, if no young people congregated, they will look for some other places that young people might be around. So, for example, around finished school time, around Mayfield School, that is one of the places that they attend. And lately, because I think there have been Chetwell Heath and Seven King area that the young people reported that there's certain experience about violence, so they tend to go down there to meet some young people, and so they tend to go through different occasion and different days. Sometimes they will go to Little Heath around Reppich College, that kind of area.
Okay. It would be nice to know. I mean, and are there any locations in the west of the borough that the youth workers go to as well? It seems like it's all centred in the north and in the south, you know.
Yeah, I do appreciate that. And I think what we are working very, very closely with community safety and the police is, if any intelligence that they can share that with us that we need attention, we tend to send the detached worker to go around there. So I will making sure that their presence in the community is balanced across the borough. So I will take that on board and review their work.
Thank you very much, Chris. I appreciate what we're all trying to do with such a limited budget. I do understand, you know. Thank you very much. Thank you.
Councillor Littlewood.
Thank you. I thought it was very interesting that Colin mentioned the community hubs, because I sat in a lot of the co-design workshops for the Seven Kings Community Hub, and everybody was saying, "Oh, we need things for young people and so on." So in the light of the fact that we're as has been explained over the years, we're getting away from institutions where young people gather to do stuff, to more outreach. I wondered what the youth provision in the community hubs would look like. What is it?
So I think from our point of view, I think one of the things that we pick up from the young people, I think, is that the kind of traditional model of a youth service, I guess, if you like, which is, look, here is a building in which activities are organised and structured, and you come along and there's a programme. Young people are looking for something that is much more effectively determined by them. It is much more flexible around what they want and what they need. So, for example, when we've been talking about what we think the revised provision of the youth centre at Loxford might look like, one of the things that's come up in our dialogue and consultation about that has been about the difference between the extent to which you have a space in which you can, as staff members and as a council, organise activities, and the extent to which actually what you create is a space that young people would effectively want to be in and want to do the kind of things, because predominantly what they actually want is to talk, to have places where they can meet, to have places where they can gather together, rather than the previous view about structured activities. So in a sense, the core bit for us around the community hubs is making sure that actually they are accessible to young people, in the sense that they are places that meet their needs. They feel comfortable, they have got the right kind of furnishings in them, they've got the right kind of atmosphere and ethos in them. It is that we're looking at, because the council will, I don't think, be in a position where it can replicate what it would have done traditionally in youth centres in lots of different buildings. So what instead it's got to do, we think, is actually make lots of different assets what we'll call youth friendly, so that young people will effectively want to use them as places where, to use an old 1970s phrase, hang out together. So that's the focus that we've got for it in terms of how we think it will work.
And supplementary to that, how much of, for want of another phrase, control will the young people have about how those spaces are used?
So our vision at the moment is that in actual fact they will have pretty much complete control over how the space is used. We do recognise that there has to be an element of central coordination and organisation around community hubs. But if we think about the principle behind them in the first place, it is about a place that is made available for the community to decide what goes on, how it gets organised and how it operates. We don't see the provision for young people being any different to the provision that would be available for the under fives, for adults, for anybody else. We've got to treat them, in our view, the same as we treat everybody else. So we want them to have a pretty autonomous, I guess, if you like, open opportunity to use these facilities in the way in which they think would be what they would want to do.
I absolutely agree with that. I'm just wondering how that will be achieved, but I'll stop there.
Councillor Adams.
Thank you, Chair. Thank you, Colin, for your presentation. My questions were just around interaction with third parties. I know in the report, you've got a few on there like Duke of Edinburgh and other third party schemes like that. I'm surprised to see the lack of engagement with just other third parties in the borough and utilising kind of their services, particularly as the services, perhaps come under a bit of strain in recent years in terms of the ability for provision and stuff like that, and having to do things differently because of that. So I'm just wondering why we're not really engaging with those other third parties, because community and youth work and stuff like that not only happens at the council level and the state level at the schools and that kind of thing, but there's obviously a whole local network and community happening at that micro level, and I'm just wondering why the council's not engaged with that from this perspective.
So I think there are a couple of things. I think one of them is historic. I think so. There have been a number of changes to the way in which youth provision is organised, and it's taken time to work that through. One is the shift, obviously, to the way in which it's split between the council and vision in terms of delivery. But I think the bigger issue is about the youth provision and the funding for it changed, and the youth service tried to refocus itself in terms of a targeted service. It tended to focus on young people and what it offered to them directly. And Chris was talking about, for example, detached offers and how that works. One of the things I think we've identified, and I said at the beginning when I was introducing the report, that one of our core priorities, I think, going forward is that actually we've got to take the youth offer and start to embed it and integrate it into the wider agenda. So in other words, by that, what we're talking about are things like, for example, how we actually work in conjunction with partners in future to deliver the youth service. So it's less about, for example, youth services over here, voluntary sector provision is over here, what happens in the faith and religious sector is over here, and actually looking at how you group around a common agenda rather than a model of delivery. So that's what we're looking at going forward, and that's why we think by moving to priorities and how youth work contributes to that, we think we'll be better placed then to balance up that need to support young people who've got particular needs, whether it's at a case level or a targeted level, with the fact that actually in order to maximise the potential to impact on young people, we have got to find ways to collaborate, which will be about, if you've got a particular activity, for example, in an area of the borough, actually we want to facilitate that to happen and grow, rather than us to provide something that effectively runs in conjunction with that or runs potentially in competition with that. So that's something that we think we need to develop.
If I may add what Colin has already said, in the report I only listed the most frequently work with a third sector organization. We have got a list of other offer like the Scouts, and like, for example, you might have heard kinds of box of crime. If some young people they like boxing, we will refer them. It's just like the case that the relationship is a little bit different. So, for example, with Frankfurt Cups, they have got funding to get coach to work with young people, and then we've got youth workers. So we do join up working together, but some other organization I have not listed in there. It's just a case that our relation is very, very different because we cannot do everything on our own. You're exactly right. Some young people would benefit from other offer, and we want to making sure that they know where it is, and more important is we need to make sure that it is safe for them to take part.
Yeah, thanks for that, Chris, and that's reassuring to know that the list on the report wasn't a full list. I sort of have two comments in response to something you said, Chris and Colin, just for thought, really. Firstly, Chris, I think it was Councillor Hatfill that mentioned that people that kind of just miss out on being recognised as having a need, and I wonder, with the links with all these organisations, how effective we are if we kind of spot a child that actually could benefit from these third-party services, but they don't quite meet the threshold for having kind of direct special need from the council. To what extent we say, oh, hold on a minute, but let's put you in touch with this third-party organisation, because we do have an issue with gangs and stuff in the borough, and at various levels, right? Many of the youth have need and would benefit from these services. So to what extent there's a culture at the council and the workers to say, actually, okay, we've got these young people here, I think they just benefit, and let's just put them in touch and let them know what the offering is and what's out there. How much of that is in the day-to-day culture. And Colin, I know you mentioned at the beginning about agendas and stuff like that. You mentioned specifically agenda and the green agenda and stuff like that. I suppose I was just not concerned, but I wanted it to be a bit more holistic than that, rather than just here's the agenda and we've just got to focus on that, because there are other services, and it looks like there are other services, right? I was aware of Box Up, and I was surprised that wasn't on there. So it's about, okay, well, how do we reach out broadly? Not just here's the social agenda, but actually, you know, there's how do we get kids engaged in not just hanging around on street corners, but there's other stuff to do, whether it be Box Up or football teams or other recreational activities that are out there, you know, boating and fair off or whatever it is. So how do we engage with all those different organisations? That was just a comment which can be rhetorical if you want, but you can respond. So.
I'm happy to give you a quick response on that, Councillor Adams, on both points actually. So the first bit would be about the kind of the issue about signposting and raising awareness. I think we're increasingly effective at that in the youth service. And I think one of the issues that we've got is that actually our partners, and to some extent the services we deliver ourselves, we're starting to get a greater degree of flexibility in terms of the criteria about how you do and don't access these. And again, I think that's partly come from the pandemic, because effectively the pandemic has forced everybody to think about how we respond to those in need. And sometimes I think what we've got to do is actually make decisions about how we best help people, rather than whether or not people tend to fit into a set of criteria that we might have developed in an abstract way. I think the second thing I wanted to talk about would be an agenda. I wasn't talking about that's the agenda for young people. What I was really talking about was the fact that actually the extent to which the youth service is a catalyst for change. And so it's the way in which the youth service is seen. So when the council is developing council-wide priorities, and the council would, for example, always have considered schools to be an element by which you deliver change, and you deliver changes in attitude and thinking, and you raise awareness. And it's just simply making sure that we put the youth service onto that agenda, and we see youth work as a part of that catalyst for change, in the same way that we think about schools and colleges and the work that we do through targeted intervention. Well, that's really what I meant by
that. Thank you. Councillor Gomez.
Thank you, Chair. A question to Colin. Do we have any idea of approximate numbers or percentage of children who are excluded from schools who go to offend, and how proactive are we as an authority to work with excluded children from schools to avoid that from happening, if applicable? Thank you.
So what I can say, I can't tell you the exact percentage, Councillor Gomez, that end up offending, and the link between offending and school exclusions, although Chris, it's possible that Chris will know the figure, but I don't know the figure off the top of my head. But what I do know is that when we did some work through the Youth Offending Management Board and we looked at disproportionality, we looked at the makeup of the youth offending cohort, and we tried to identify in what ways that youth offending cohort was disproportionate. And then what we tried to do is track, I guess, if you like, common factors about that cohort to try to identify what the potential issues might have been. And what we have identified is the correlation between the number of young black men who are in that cohort in terms of the youth offending, and the correlation for them between their existence within the youth offending cohort and whether or not they experienced exclusion at schools. So we've identified that potential link. I'm not quite sure it's a causal link, in the sense that I don't think the exclusion in itself leads to the youth offending behaviour, but it is part of the thing that we've got to explore further about the impact of sometimes societal or family related issues or peer issues on young people's lives that lead them into that. And what we also are clear about would be the fact that actually we just started work with schools to look at how we look at alternatives to exclusion, because the potential consequences of exclusion, not just in educational terms but in social terms, and in this case in terms of potential engagement in criminal activity, can be considerable for young people. So we've identified that link between the two. I don't know if Chris knows the actual percentage, but I know we've been looking at that link between them.
Yeah, I think on average, looking back the last few years, it is about looking at the youth offending team cohort. It's about 20% of those young people supported by the youth offending team. They might have experienced either currently being excluded or have experience of either fixed term or permanent exclusion. But Colin is right; it's only a factor affecting those children and young people rather than because they were being excluded. And at the moment, what we are working very, very closely with my colleague, again, is part of education inclusion, those colleagues looking at who are the students who might most likely to be excluded from school. And then we have got some staff in the report mentioning about the mentoring project, and they are actually, we have got so-called a youth officer, the youth worker actually work with them, trying to support them to engage in their education and change the behavior and trying to stop them being further exclusion. So I think this is some support that being identified from behavior inclusion team as well as supported by my staff team.
Follow-up question, Chair.
Yeah, that's fine.
Thank you. What relation is there between exclusion, offending, and special needs, if you know it? I don't expect you to know everything off the top of your head, only if you have an idea.
We do think that there are clearly factors around special educational needs and exclusions, and there are factors around special educational needs within the youth offending cohort, particularly around speech, language, and communication for some of the young people in the youth offending cohort. And we also know, obviously, there's a correlation, as we just said, between the youth offending cohort and those who will have experienced school exclusion. The bit at the moment, and the reason why we're doing that individualised work, is to try to work out whether or not all three of those are linked together. So what's the potential connection, I guess, if you like, between the SEN and exclusion and appearance in the youth offending cohort? So we know there are definite correlations between them. We're just trying to work out the extent to which the three of them actually link together as a triumvirate, I guess, if you like.
Thank you, that's very helpful.
Councillor Noor.
I think so. There is a lots of questions everybody ask about youth provision. I wanted to ask this particular issues about, but I think so it's a long time. But if Colin think that is a repetition, please forgive me. But I think so I need to ask this question for my clarification. In terms of the youth provisions as asked by the councillors Littlewood about what do you mean by the provisions will be available for in our what you call community hub. As you understand that our youth now become the tech savvy now, they're not really willing to stand or do some sort of activities as we used to do about 15-20 years ago. People used to play lots of things indoor and also some community activities. Now, are you putting some sort of computer games there or some sort of activity with to learning about some sort of design activity to develop their performance in their extracurricular activity? Or are you linking with the local youth group with the community hub so they can utilize their time there without going on the street on the wrong hand? Or are you planning that local sports clubs or other provisions, they can come with a form a partnership with the council? Because this provision is a wide definition, the provision, because my understanding is that I haven't clarified any details about these things or any definite answer that what are you expecting or what you intend to do. And if this is the case, that what I define was associated with the funding formula, how it will be run, who will be controlling, and in terms of the management responsibility, who will be managing it? Is the private manager or council directly manage these facilities, or local community partnerships will form, and who will maintain these places for long-term running and also cost as well? So I did lots of things in there, but I think it's all relevant because community hubs are is up and running and also coming within our remit as well. Thank you.
As you said, Councillor Noor, there's quite a lot in that. But what I think I'd say would be, in terms of, you're right about that change, young people moving away from organised activity to technical things. We do see the provision of computers, digital skills, not only something that will engage and attract young people into the spaces that we create, but is also an integral part of how we partly bridge that digital divide. Actually, we plan to do that, I think, in two ways. Some of it will just be about facilities that we make available for young people to access as and when they need for whatever they feel they need to do it for, which would be about the provision of, I guess, if you like, good quality hardware and software, good internet access, fast download speeds and so on. The second bit of it, I think, is sometimes specific skills that we want to develop, which links into technicalities. So, for example, one of the plans that we've got for Loxford Youth Centre is a significant investment in the music studio within Loxford Youth Centre, not so much in terms of the production of the music, but the skills and the confidence and the experiences that young people get through the process of doing that. So that's, I guess, if you like, what our plan is around how technical skills will become a part of the youth offer. And then in terms of just the community hubs, it's not actually under me, but my understanding of it at the moment is that's still to be determined in terms of how individual hubs will be managed and funded. The bit that we know about would be when we put services into that, there'll be two bits. We're either, from a youth service perspective, investing in facilities, which is hardware, televisions, computers, a bit again like what we're doing at Loxford, or it will be about us funding the youth workers that we've got who will go into particular centres or hubs on particular days or particular times, and they will work with young people. But how the council will, on a more broad basis, fund the infrastructure that the hubs will develop, I think that's yet to be, as far as I understand it, that's yet to be pinned down and finalised. There are a number of different options for that are still being explored.
Colin, thank you.
Councillor Ahmed.
Thank you, Chair. Thank you very much, Chris, for the report, which actually gives the context of how youth services are run. I have questions around section 6 and 7, the delivery structure and the future plan. So first of all, in terms of the delivery structure, you've mentioned that you follow the guidance by the government. But in terms of referrals, do you go by referrals only from other services involved there, or do you also take referrals from, community levels or the schools and other areas who are not directly involved with the council services? So I'm quite interested to know whether it takes on board someone who can external come and be a part of it. The reason for asking is that some of the young people, they could be known to police, they could be known to mental health services, or they could be known to even carer agencies and stuff who may require certain help. So if there was something available, whether that is at all, it would be good if you could give a context on that as well. It was not quite clear in the report. The other thing is around planning. So is this the exclusive plan that has already been planned for 21-22, or there is kind of like more details available elsewhere? Because I was thinking that it was a bit of a context given that how it would be run and how you'll be exploring things. Is there room for further kind of like suggestions and plans? Because I think, which Councillor Ross has previously mentioned, this could be a valuable report for the Youth Services Task and Finish group, which would give them the context to find out recommendations way forward. So is that something that could be included through you, Chair? I would also like to explore that bit. Thank you.
There's a couple of bits I think in that, Councillor Ahmed. The first bit would be in terms of referral sources. Chris can list all the different ones, but effectively that would cover a pretty broad range from self-referral from young people who feel they might need support, to referral from internal agencies within the council, to schools making referrals, and then the referrals will also be done at 2 levels. Sometimes referrals are individualised. It is about a particular young person. Sometimes referrals are about an issue, actually, and where that issue seems to be, I guess, if you like, prevalent, whether we call that a hotspot or something else. And then sometimes referrals are actually about, and I guess, if you like, a priority, that a message that the council is trying to get at as well. So actually, sometimes we go and deliberately try to target young people to get them engaged. So for example, we target groups to try to get them engaged in the Children in Care Council, the Youth Council, sometimes because we want to access the voice, but sometimes because in actual fact we've got an underlying intention behind that, which is to support young people in terms of self-esteem, confidence and so on. So it's a pretty broad range of referral sources that a youth service would take. In terms of planning, the reason why we've done the plan as it stands at the moment is partly to reflect the fact that of the uncertainties around COVID. And so effectively, we're not quite sure as we plan ahead for the rest of 21-22 what exactly we'll be able to do in terms of face-to-face, not face-to-face, what our options might be in terms of the future working around the services. And part of the reason for it being done that way is because we did want to leave it open in a medium to longer term basis for what will come out of the task and finish group, because we felt that actually that was the bit that will hopefully set a series of priorities and areas to focus on, which will determine what the, I guess, if you like, the strategy for youth service delivery will look like for the borough for the next 5-10 years into the future after this year.
Thank you.
Thanks, Colin. Councillor Gomez, is this the hand from previous question, or have you got a new question? Any other member? Colin, I think going back to what I would
Chair, I think
benefit,
Councillor Norman has raised her hand.
Oh, Councillor Norman.
Thank you, Chair. I just wanted to put a bit of a pitch in here for the work that's being done over the child-friendly borough initiative, because they've finished the discovery phase, which involved talking to over 2,000 young people about what their ideas were, what they wanted to see. Under the UNICEF thing, they had to choose 3 badges they wanted to work with. And going back to Councillor Adams' point, one of them was place, which obviously takes in the environment, green issues, etc. Also, to address your point as well, Councillor Adams, about the third sector, there's been a steering group that has had representatives from education, early years, the third sector, and very much a very integrated group looking to deliver on what the young people have actually identified. So, I mean, I think that's a very useful piece of work, and it might be something that this scrutiny committee would like a more detailed report on, because there is a very good steering group. The voluntary service have got youth advisors who are doing work. We've got child-friendly ambassadors in all our schools. So it's quite an extensive piece of work that I'm sure, you know, the committee would find very useful to maybe hear more of.
Thanks, Councillor Norman. Appreciate the update.
Councillor Gomez, you had something that you're doing in September. Did you want to mention it now? I apologise. I think I suggested later, but maybe now is the time if you want to mention that now.
Thank you, Chair. I appreciate that. Yes, to share with colleagues and Colin and Chris and other members of staff, that I'm organising the second youth engagement event in Church Fields on the 18th of September. Yeah, on the 18th of September. It's going to be held in the Memorial Hall in South Woodford. And publicity will shortly be going out once we have agreed details with speakers and so on. Thank you, Chair.
Thank you, Councillor Gomez. I'd just like to put in a plea to Colin. The visits to youth club, if we could have Loxford, but another youth club, whether it's Wanstead or whether it's Hainault, just for us to see as a comparison what facilities, what services are being provided for the committee members to attend. Added to which, I would like to add a youth offenders provision as well, which would inform our understanding as members when we're looking at papers presented to us to see firsthand what exactly is happening frontline. Yes, we're making decisions and we're looking at things that are on paper, but it would be helpful to actually go and get an opportunity to see what is happening at the front line. Any other members for any comments? No? Colin, thank you so much to you and Chris and your team for a very interesting report. Thank you. Can we agree to note the report and the comments made?
Agreed. Thank you.
Yeah, agreed.
Agenda item 8, the work of the educational psychologist in Redbridge. We've got Claudia Michael, Specialist Senior Educational Psychologist, who is going to talk us through the presentation that was circulated to members for her to summarise and provide us with what the outcomes of that work was. So over to you, Claudia.
Thank you, Chair, and thank you, members, for inviting me. I know you had my report in advance, but I'd like to share my screen so I can run through the key points.
Thank you.
I'm sorry if you can hear my dog barking as well. He is a little bit frustrated because he's missed out on his evening work. He is locked out, but I'm sorry if you can hear that in the background.
So we love dogs, so it's all good.
So I'd like to share the work of our team. We are a fairly new team to Redbridge. We established just over 3 years ago, and the aim of our team was to be able to support schools with their knowledge and understanding of supporting children with their emotional well-being and mental health. And our remit has actually broadened in the last 3 years, especially as a result of COVID. And I'd like to share with you what we've done up till now and what we're planning for the future as well. And I'd also like to share with you some of the work that the government has given us to roll out into Redbridge as well. So some of our services are targeted services, so only the schools that have been identified can access those services, or they've been asked to join a specific project. But the majority of our services are universal services that all Redbridge schools, as well as our college and our special schools, can access as well. The first piece of universal work that we do is our ELSA training, and we are very proud of our ELSA training. It has been a fantastic programme to be involved in. It's a 6-day training programme which has been designed to enhance the skills of teaching assistants and learning support assistants to enable them to work with children who have identified social, emotional, mental health needs. And the aim of the ELSA programme is because schools were struggling with the amount of referrals they were having to make to our CAM services, the lack of services that were available. So schools actually started saying, well, what could we do ourselves? And the ELSA training was the perfect answer. So we train up these LSAs and teaching assistants, and sometimes we've even got a few SENCOs enrolled in the ELSA course as well. And they get this enhanced 6 days of training on a variety of different mental health areas, such as we've got understanding anger, emotional literacy, friendship skills and social skills. And once they've had the 6 days training, we don't just send them out and say, right, you're off into schools doing this work, working with individual children, running groups, doing a bit of inset training for staff as well. No, we actually do provide termly supervision for them. So we bring them back together as a group and we offer them more input, more training, and also opportunities to problem solve around tricky cases they're working with in their schools. So it's been a fantastic programme. We actually identified that our special schools needed ELSAs as well. So we put together a special ELSA programme for our special schools so that they could actually access it as well. And that's been running for the last 2 years. You can see a picture of us standing outside of Hatton School. And you can see by the figures that we've actually been very good at getting ELSA training rolled out to the majority of our schools in Redbridge. We actually have over 130 trained ELSAs altogether. And as you can see, out of our 59 primary schools, 42 of our primary schools have got trained ELSAs. And out of our 19 secondary schools, 17 of them have got trained ELSAs. And yes, 3 of our special schools as well. Unfortunately, COVID hit in the middle of ELSA training last year. But from March of this year onwards, we've been able to re-engage ELSA training face-to-face again in our schools, and we've actually started a new cohort of ELSA training as well. So we're back on our path of getting all schools 100% ELSA trained. So our next piece of work has been our emotional wellbeing, mental health, designated senior lead training. And we call them DSLs for short. And that's not to get mixed up with our safeguarding DSLs, which are a whole another group of DSLs that work in schools. Now, the government had an initiative after the Green Paper that said all schools should have a senior member of staff who's responsible for emotional wellbeing and mental health. And that person would lead mental health and drive it throughout the school. It needed to be a senior member of staff. So it's either the head teacher, the deputy head or assistant head, or sometimes the SENCO. And we've also provided them with a 2-day training package whereby we've given them some resources and helped them along the way to getting mental health and well-being a priority in their schools, and not just for the pupils, but for staff and for parents as well. And again, we provide ongoing supervision for our DSLs. So we meet them every term and give them further input as well. And as you can see, just over half of our primary schools have a trained DSL. And again, 17 out of 19 of our secondary schools have trained DSL as well. So some of the key work that we've had to do with our schools is to actually talk to the young children themselves. And I know Chris has mentioned some of the consultation work that's been going on with the youth services as well. And over the last 3 years, we've run quite a few competitions. We've asked the children, you know, what's the impact of COVID been on you? We've actually run a very big piece of research and we've had over 2,000 responses from our Redbridge children, and that report is being analysed at the moment. We worked with Southend local authority on that piece of research. It's going to be published at the end of this month, but it tells us some really key issues around the impact of COVID in our schools. One of our other competitions was last year. We did a lockdown competition and we asked the children and young people to submit entries around what did COVID mean for them. And The picture that you can see on the right-hand side was one of our first prize winners. She drew this human lockdown cage, and it kind of just was like all showing her feelings around being caged in at home, and you know, the world was going on outside while she was just at home doing her home learning. So we loved that picture. And this year we've actually got a competition where we've asked children to write a letter to COVID, and we're currently judging the entries this week, and we'll be announcing the winners next week. So a couple of key priorities that we are working on from the autumn term onwards, but we've already started some work on, has been suicide prevention. By working with the ELSAs and our DSLs, we have heard about the increasing rates of self-harm in our schools, and unfortunately the loss of life due to suicide. We've been seeing increased attempts of suicidal behaviour, and so we really felt like we had to address this quite quickly. We've worked with Papyrus, which is a charity which aims to prevent young suicide, and they have been fantastic at providing training for our schools. All of our primary schools and secondary schools have been offered a 90-minute suicide awareness training, and we are currently proposing that all of our schools across Redbridge will have an assist-trained member of staff, which means that they have been trained to spot the signs of suicide and also to be able to put a plan into place to prevent suicide for the child, working alongside the parents and other agencies as well. And we're hoping to use some of our funding this year to be able to get that rolled out in the autumn term as well. So this picture just shows that we've also did a bit of consultation with our schools. So we've asked the schools about what work they've actually benefited from in the last year and what work they would like to see more of. And we analysed that and helped us to put together our programme for this year. And the programme that we had this year was actually led from the government, and it was called Wellbeing for Education Return. And this was an £8 million package that was rolled out to all local authorities across the UK, whereby the Department for Education and Health England and Public Health England as well put together some funding to allow us to prepare for welcoming the children back to school in September. So we went along and did the training, and we got some funding from the government to enable us to roll out this training package across our schools. And this just shows you some of the work that we was able to do. So we provided some support sessions for our SENCOs, because we knew that the children who did have special needs were the ones that struggled during lockdown at home, and also their parents struggled as well. So we put together a telephone support line for the parents to be able to ring an educational psychologist and speak through some of their concerns, their children's anxieties and their worries around behaviour. And also we felt that we needed to inform the school governors about what was happening in schools and how the schools were planning to welcome the children back. And we've met with the school governors every term since last year to give them an update about what the work that we've been doing as well. We was also really fortunate to be able to put together some parent workshops, and we've had an amazing response to those. We put them on at different times, so some during the day, some during the evenings. We've also translated them in a few of our home languages as well. So we had some of them delivered in Bengali. We recently had one that was delivered in British Sign Language for one of our deaf parents. And the parents have really welcomed just being able to talk around their anxieties, but also to get some really good resources to be able to use at home with their children as well. So the last piece of work that we've been involved in this term has been the establishment of our mental health support team. And again, this was a government funded initiative whereby we was able to employ 8 education mental health practitioners who are able to work with individual children referrals for children who show low-level anxiety or behavioural difficulties, and they are able to support those children with some cognitive behavioural therapy or to work with the parents to help them with behavioural interventions in the home as well. And we also have a coordinator for our mental health support team. And as you can see, these are the schools that are involved, where we have 5 primary schools and 5 secondary schools. That started in January, and in September we are going to do a review with those schools, and also we are bidding for more government funding so that we can roll this out widely to more of our schools as well. And this just shows some of the criteria of how we identified which schools would get the mental health support team, because we often get asked, well, you know, we've got all these schools in Redbridge, which schools were the ones that needed this support? Well, we actually looked at current patterns of anxiety and low mood. We also looked at schools where there had been higher levels of self-harm and suicidal attempts. And also we looked at their current engagement in mental health and wellbeing programs, and the fact that they needed to have a DSL in place, because that's the person that we liaise with as well. And like I said before, they deliver those evidence-based interventions for children, and they also do quite a bit of signposting as well. And they do psychoeducation, so they provide training for school staff, which is very much needed. Our final project this year is a very exciting one, and this one has actually been led by our trainee educational psychologists who are based at the Tavistock Clinic, so they're training to be educational psychologists, and they put together a programme which is called our Redbridge Race and Equality, or we call it Race and Equity Workshop. And the aim of this workshop was to help schools to think about what are they doing to promote equality in their schools. What are they doing to become anti-racist schools, and to look at their policies and to look at the practice in their school, to look at the resources, and to also ask the parents, ask the children and ask the staff, you know, how well are we meeting our targets for being a race and equality school? And basically after they've done that, so they've sent out questionnaires to all the staff, all the children, all the parents. They've analysed that data, and then we've given them a bespoke toolkit, which has helped them to think about, oh, here are some ideas about what we need to do better. We've analysed some of this data, and here are some of the things we're doing, but here are some things we need to do even better. And we've put these 9 schools together, and last week we actually had a celebration event where all of the schools were able to share their action plans and what they've learnt so far on the journey. And the project won't stop there, because we'll be rolling it out more widely from September, and hoping to get at least half of our schools involved in this project by the end of July 2022. So that's our target. And the 9 schools involved at the moment will continue to be involved by having continued supervision with us, and sharing resources and sharing ideas with each other as well. So once they've been on this journey and they've completed at least a year's worth of support from our team, we're going to call them a RIA school. So they've done the RIA project, so we've kind of given it an abbreviation, and we're going to give them a certification to show that they are schools which are looking at their policies and looking at their data and continuously trying to improve. And us in the root team as well, we've also looked at disproportionality as well. And the thing we decided to focus on was the fact that there are not many Black and Asian educational psychologists in the country. It's a well-known fact that we in our career path have been able to establish that, you know, why is it that we don't encourage people from ethnic minority backgrounds to get into the profession? So we've worked alongside the university, and we are running bespoke workshops to help identified Black and ethnic minority people who want to get into the profession to be able to join the profession. So we're giving them some guidance around the entry criterias. We've actually provided a place for a volunteer to join our team, to shadow us and to learn from us. And also we have put on some workshops in our secondary schools aimed at years 11 and 12 for them to understand what is the role of an educational psychologist, and to just plant the seed of an idea into the young children's minds that, oh, I could leave school and go to university and do this job. It's accessible for me. I just haven't heard of this career, but here it is, and maybe this is something I can aspire to do. So that's a project that's running this term as well. And again, I think I've covered this slide. It was just summarising what we've been doing for the summer term. We've been very, very busy, and we look forward to another busy term in September. The two good pieces of news that we've got for September is that the government has even given us more funding to continue our WER project. So again, we'll be rolling out more parent workshops, more support into schools, more children workshops as well. And the second piece of good news is that we have been granted a place on the Anna Freud Link programme, which is a fantastic programme which helps all of education, social services and health to think together more collectively about how they support mental health and well-being in schools and how they work together. You know, what are the referral routes? How do you have conversations? How do you share information? And they will be doing some consultation with us. They'll be asking our schools what, you know, how they found our services so far, and they'll be helping us to do more joined up work. So we're really pleased to be on that project as well. So that is the end of my report. I would welcome any questions.
Claudia, I'd just like to applaud you for the wonderful work that you and your team are doing. That's amazing. It's an awful lot of, I mean, when I saw the presentation, that I didn't fully appreciate or grasp how much your team is doing. I just wanted to know, in terms of time frame, you said July 22. How long is your remit for this work? Is that the final date, or is there more time?
Yeah, the July 22 was just a target based on the RIA project, which is our newest project, the Race and Equality project. And we have a 50% target for that, for 50% of our schools to be involved in that project. And we've given it a time frame because that project is slightly unique, because it is the first project that we will be running where we will be using a traded model. So schools won't be able to access that project for free. They will have to pay they would have to pay the route team to be able to join that project. It's because the fact that we are going to become a tradable service in the future. So it's our kind of first attempt at being traded. But I think because of the success we've had on the project so far, I think schools will be willing to pay and willing. And so that's why we've given ourselves a 50% target.
Great, thank you. Councillor Hatfield.
Thank you. Listening to the presentation now, it is clear your team are doing a lot of work. Reading the presentation to start with, I have to admit, I found it a bit difficult to follow because of all the abbreviations and REWT, MHST, REA, EOSA, EWMHT. I've got to admit, it took a lot of time to get my head around some of those abbreviations and terms, and I've got to admit I did struggle always to keep track of what they meant. So as a layperson, and I'm as bad at this when I do presentations as everyone else, I know what the terms mean, so I stick them in. But as a layperson, I think it would be easier if we had a bit more gentle explanation. So I don't think the presentation ever said what REWT, the team name, means, what it stands for, and actually a bit of introduction saying what your team does at the very start would have been nice. So
could I just come in at that point and just take that bullet for Claudia, because I think if you remember, I think we just sent round this presentation to inform members of the work of the team, and it was then subsequently put on the agenda. The presentation was originally for another audience rather than members. So it sort of came by a circuitous route, and I take full responsibility for the acronyms.
No, that's fine. I totally understand. I just did want to point out that I worked out what most of them were, but I certainly found them quite hard to follow. So I'm sure other members.
Thank you for that reminder, Councillor. I think when we work in schools, we do take it for granted that everyone knows our acronyms, so we do have to be a bit more careful with them. Thank you.
But apart from that, I do think the team is working very hard, and I would certainly like to see them in more schools if possible, because I think it's with the growth of mental health and other things with children, it's certainly an area that is more and more vital. So I think you're doing wonderful work. I just think the presentation was a bit acronym heavy.
Can I just remind members? I do apologise. I'm losing track of time. Cal, sorry. Can I just ask you to remind me what's the guillotine time?
The guillotine time, Chair, is 3 hours 15 minutes. So around the 10:30 mark.
Okay.
I think we've got one or two. You've got your direct payment outcomes and the BCR and work programme items. They're the main items.
Right.
Remaining.
Thank you. Thank you. Thank you, Cal. Councillor Mrs. Nolan.
Thank you. Truly, I don't talk to Councillor Hatfield before the meeting, because everything you say, Councillor Hatfield, I think I'm going to say, because I absolutely agree with you. I really hate acronyms, but Claudia, it didn't detract from the wonderful work that you're doing, and it's absolutely amazing, and I do applaud you. It's such a vital thing you're doing with young people, because it is one of the most important things at the moment, and vital. Having got 2 grandchildren of school age, I know how the pandemic has affected them. One's in secondary, one's in primary still, and they really have been amazing how they've actually coped with this. But what you're doing, it's incredible, and thank you so much for letting us know the work that you're doing, which we would never have known about, which is amazing. Just a very quick question about the pilot schools. How did you decide what schools that you would use as pilot schools? And that's particularly in relation to is it the RIA project?
Yeah.
Yeah. How did you choose them?
Actually, we didn't choose them, Councillor. They volunteered to be in that programme.
Okay.
So what it is, after the death of George Floyd, and some of our schools contacted us and said that their children wanted to do things to show their support and solidarity for Black Lives Matter. We as a team felt that we needed to not stay silent about Black Lives Matter, but also to work with schools to help them to think about becoming anti-racist schools. So what we actually did is we put together 2 workshops around understanding racism, the impact on children, the impact on families and on staff. And we ran these workshops, and we had about 60 staff members turn up. So when we was going to put the idea for the RIA project together, we actually wrote to those 60 staff and said who would like to do some further work in their schools. We wrote specifically to the DSLs as well. We copied in the head teachers, and we had 9 schools that came back to us. In fact, there was 10 and 1 dropped out very suddenly because they had a lot of issues in the school and couldn't commit at the time. But then those 9 schools were really grateful, because especially finding out now that schools who do it in the future will have to pay for it. So those schools were incredibly grateful, and they have shown some amazing responses, and some amazing work has gone on in those schools so far. We've already seen the changes as well.
Okay, thank you, Claudia. So this was a project specifically targeted at the death of George Floyd. I might be a bit controversial here now, Claudia. All lives matter, not just Black lives, Claudia.
Okay.
They do, and I think, although I applaud what you're doing, I think it's kind of like you're centering just on one thing, aren't you? So are you going to be able to expand what you do with other schools about other issues?
Other issues to do with race inequality?
Racism, anything, illnesses, safeguarding, domestic abuse, anything that would affect young children, because particularly at the moment with the pandemic, obviously children have been at home a great deal, and they may have been exposed to things that perhaps they shouldn't have. So yeah, it'd be interesting to see what other issues that you might expand on.
Okay, so other issues that we're currently working on at the moment is we've recently just put a training package together around understanding the impact of gang violence as well. Yeah. So that's another issue that we've noticed that's been creeping up. And we have really tackled lots and lots of different issues as well. I mean, I can't think off the top of my head, but we have about 12 to 15 different workshops that we put on. one of our latest ones was around having difficult conversations. And that was difficult conversations that go on between staff members, but also difficult conversations between staff and parents. And so we was able to give quite a lot of input into that, and the staff really valued that one as well.
Excellent. That's fantastic. And I think that, it's amazing, isn't it, how children actually tell you things and talk to you and their concerns, and it really kind of makes you realise how, you know, what children actually are thinking and feeling, and it's really, really important to take that on board. So wonderful. Thank you, Claudia. It's an excellent presentation. Thank you. Again, didn't quite understand everything, but I kind of know what you're doing. Thank you.
Thank you.
Thanks.
Councillor Noor.
All right. Thank you, Claudia. And I just start with saying about the lots of acronym used, and don't worry that I'm happy with this, because as a lawyer, I used to, and all lawyers, I use this kind of acronym because there's lots of long name of the Act of Parliament. So we are used to it, and we are happy. If you don't understand something, we try to understand and even guess something. So nothing wrong with this matter. I'm happy with this. Though some colleague raised this issue, that's fine as well. Right. In terms of your report, it is something new for me in terms of what you're doing, and I very much appreciate your work. And what you just said, the last part of your presentation about the mental health expert or psychologist in terms from the BME communities, I think you are right on this matter. But I just to share with something happy news as well. One of my family member as well, she has a doctorate on psychology. And so there is an example there. But I think so you are right. We need to recruit more people. And what are you doing from my point of view is much appreciated, and we should continue, because especially during this push COVID situation, and this is something will be a serious issue, how people coping with this situation, especially the children, those are vulnerable.
Councillor Noor, sorry, Councillor Noor, can you ask the question, because like I said earlier, we haven't really got an awful lot of time.
No, I'm
so,
there is no question, Chair. Just a thank you. So thank you. Yeah.
Okay, thank you. Councillor Santos.
Apologies for interrupting, but I it's just that the comment about Black Lives Matter, and I just wanted to say to Claudia, I really applaud you and the team for picking up on that issue and for dealing with that issue. And actually, it's really important for people to understand that when people say Black Lives Matter, it isn't saying that other lives don't matter. It's a recognition of structural racism. It's a recognition of the fact that some people, because of the colour of their skin, are not treated as equally and fairly as others. So I really think that George Floyd was a moment and a real opportunity for us to reflect a bit more on that, on things perhaps that we should have always been reflecting on and should always been dealing with. And so just wanted to say that, because I thought, yeah, I have a lot of time for Councillor Mrs. Nolan, but on this issue I think we disagree quite strongly.
Thank you, Councillor Santos.
All right, Mark, I'll survive. I'll survive.
Thank you. In response to your comments, Councillor, we have had to deal with, it hasn't been easy rolling out our presentations around race and equality, and we have had to look at challenging different points of views from people. We've had to look at challenging different language used, even using the term BAME, Black and Ethnic Minority. You know, some people have been upset with us using that because, you know, there's differing views on all of those things, and we've had to work very carefully. But it is something that we hold close to our heart and something that the schools have really appreciated us working on. We're actually going to give a couple of awards to some of our schools next week for the work that they've done on, you know, making sure their schools are racially equal. So thank you.
Claudia, I'd just like to say thank you so much for a very, very interesting presentation. And had you not come and done the presentation, we wouldn't have been aware of the wonderful work that you're doing. So well done to you and your team. Can we all agree to note the presentation and the comments made? Moving on to agenda item 9. Claudia, you're very welcome to stay if you want to, but you don't have to.
Thank you, Chair. I'm actually going to leave so I can get my dog out. He's been waiting all day for his walk. So thank you very much for having me. Take care, everybody. Bye-bye.
Thank you. Agenda item 9, direct payments outcomes update report. Over to Leila Hussain, Head of Services, to introduce the report. Leila.
Hello, thank you. I hope you can hear me this time.
Yes, we can.
Good. This is an update report following my report to the People Scrutiny Committee on the 9th of May, in which I gave the committee and members some insight into 2 research projects that evaluated the impact of direct payments for people who lack the mental capacity to manage them. And following that report, members requested an update report with some case scenarios that would reflect a cross-section of people that we work with who lack capacity, and also to illustrate how we manage those people within adult social care. So really, I would draw attention really in the report to some important information, which is really that people who lack capacity to manage a direct payment must have an authorised person who can act on their behalf. And this could be somebody who's already appointed to be their lasting power of attorney, or it could be a deputy that has been appointed through the Court of Protection. The authorised people that we work with, or the authorised person who's in that role, has a really wide-ranging, duties, in that they must act in a suitable manner and in the best interest of the person who's receiving a direct payment, and they must be involved in the care and support planning, and therefore be able to look at the relevant support and purchase the relevant care to meet the person's needs. There's quite a lot of administration attached to this, which involves providing evidence of expenditure through reconciliations, and also sometimes employing, personal assistants that can meet the needs. I've explained in the report that sometimes we have people who may be deemed to have the capacity to manage a direct payment, but in some circumstances they need additional support. And that's when we can also put in place a nominated person, and they have to act in a very similar way to an authorised person, in that they have to behave in the best interest and behave in a suitable manner and take on the full range of responsibilities and duties that's incumbent with a direct payment. But fundamentally, what these arrangements are trying to do is to promote and sustain direct payments, really, for people who lack capacity to manage it themselves, so that they have equal rights to having choice and the ability to arrange and manage their own care. I have provided 5 case scenarios to illustrate how people who lack capacity or may struggle to manage their direct payments are managed by the service. And fundamental to this is really the service seeks to support the authorised or nominated person in the same way that they would to the person had they had capacity to manage it. So there's very little differential in the research that I did into this. And the different parts of the service, provide a great deal of information, advice and support and signposting to other types of support, such as managed account providers, where that's needed. I also found evidence that a lot of time is taken with people to explain processes that they may not be familiar with, such as reconciliation processes, and also to ensure that the care plans are flexible enough to be used within a direct payment, and also that they accurately reflect the needs. There's no doubt that, you know, in some circumstances, we do find that the authorised person acting on the recipient's behalf may find the responsibilities a bit too onerous. There's the administration that they have to do, as well as the purchasing of care or employment of personal assistance. And sometimes their circumstances could change, so they've taken on the role, but then find that they have maybe other caring commitments, or find there's too much encroachment on their time to sustain that. And when that happens, we do, as one of the cases illustrates, have to revert back to a commissioned service. And also we may have other situations where a person lacks capacity, is articulating that they want a direct payment, but simply doesn't really have a support network in place that can help them to manage it. So there are occasions when those sorts of situations do arise. And I've also included a case study where occasionally we do come across misuse of direct payments. I have to say these are exceptions, they're rare exceptions. The majority of people are absolutely, you know, using them appropriately. But we do find examples, for example, you know, for the case study that I've given where, you know, a paid carer may not be genuine. We occasionally find issues where monies have been spent on things that were not indicated in the care and support plan. Or sometimes we may find, on rare occasions, we may find that the paid carer is not actually delivering the care that they're being paid for, but are taking the money. Or there may be some other sorts of abuse which could result, for example, in safeguarding investigations. In those sorts of situations, direct payments are suspended and a commission service provided whilst the issues are being investigated. I've provided you with the details of that in my report, so I'd be more than happy to take any further questions from you.
Thank you, Leila. Quick, I've only got one question relating to this. How were you made aware of the abuse that was being happening, given that the monitoring or the oversight is in the initial first couple of months, and then they're sort of left if they're okay? So was it through reporting in if they've been abused at, you know, in other ways, such as being admitted to a hospital where maybe young people isn't a mandatory? Is that the same for elderly people that are?
It can come through a whole range of different sources. Actually, it can sometimes it's actually a family member who's reporting it. You know, that can happen where they're saying, well, you have got an authorised person, but we think that there's something else going on there, and can you please investigate that? That's quite common. And also because if you employ a carer, they have to be registered for national insurance and all sorts of things, and sometimes it can come through a statutory organisation alerting us that something isn't quite tallying up in a particular situation. But more often it is family, friends, or sometimes we have other professionals going on in who then might flag something. For example, a district nurse might be going in and saying, we don't think something's quite right there, you know, and then we will be alerted to it, and then we will be, you know, looking at, you know, initially information gathering and then looking at whether we need to take it to the next step, which would be an investigation. And also we do reconciliations on a 6-monthly basis. And sometimes the invoices that we get may not quite tally up in a particular way. And that also may trigger us to do further investigations if we see that there's an invoice which clearly was a spend that didn't meet in any way the care and support plan outcomes that we were looking for. So it can be picked up in a variety of ways.
That's very reassuring, Leila. Thank you. Any member? No? Well, Thank you very much, Leila.
Thank
you. Have a good evening.
Thank you very much.
But thank you. No, it's a very, very good piece of work, and the case studies are very, very helpful, and your explanation has helped to understand. Thank you so much for coming this evening. Thank you. Right. Okay. Can we agree to note the presentation and comments made? Moving swiftly on to agenda item budgetary control report for month 2, supplementary papers 12 to 69. Can I ask Adrian to present the report, please?
Certainly, and just to reassure the committee, I won't be going through every page between 12 and 69, no. So I will keep this is a very short headline. So as members can see from the report, at the moment the People Directorate is forecasting a variance, an overspend of 15.25 million. I very much emphasise that is the position at the moment. There are a few things that we are doing at the moment. One is there is funding that is held corporately to be drawn down to fund growth. That totals about £3.5 million. Which we will be applying. It's also the case that we have taken a very prudent view of the delivery of savings and the forecasting of future activity within this BCR. And I think certainly, as per discussions that we had today, the delivering of savings is currently running ahead of forecast. So we think that there will be some improvement in that position. Having said that, the budget is under considerable pressure, and it's under considerable pressure for a number of reasons, some of which were already mentioned in the COVID presentation. We are seeing more people requiring support and service. People are frailer coming to our service. We have seen more people who have been supported by family carers, where essentially during the pandemic period, those carers have felt unable to continue to provide that support. So we've seen, for example, increased use of supported living schemes for vulnerable people. And we've certainly seen children in looked after children placements in more expensive provision than we would like, and we just simply haven't been able to move those children. But I have to say, having been through both in adults and children our higher cost cases over the last week or so, I don't think there are major savings there. We are dealing with significant levels of need in respect of some of the people we are currently supporting and safeguarding at the moment. So that is the position for month 2. The month 3 report will also be a public report, and as part of that report, we will be bringing forward mitigation plans that set out how essentially we will seek to reduce that level of overspending as it's shown at the moment. As I said, it is early days at the moment with regard to identifying what's going on. The other factor is this is uncertain territory. We don't have the experience of previous years with regard to activity. We're in a very different scenario because of the impact of COVID on people's needs. And I will stop at that point, Chair.
Any member? Wow. Standing to... Oh, Councillor Mrs. Nolan.
Thanks. Thank you, Adrian. Yeah, difficult times ahead for you, I think, really. But obviously, you know, with that 9.77, isn't it, million overspend. Things like care packages, a huge increase there, isn't it? Over 2 million there, and mental health issues, nearly a million there. I mean, do you think that the care package is an increase because people haven't come forward because of the pandemic, and that they've been looked after by family members at the time, but now those family members are going back to work, so they'll need extra care? So is that one of the reasons possibly?
It is certainly a factor. Bob Edwards and I have been out to meet teams over the last week or so, and that's very much what they are reporting. We're also seeing more people coming into hospital with no care needs, but actually leaving hospital into residential or nursing care, simply because of, whereas in the past an intervention would have gone in for that person at an earlier stage to stabilise the position. Essentially, they haven't come to the attention of their GP or whatever, so they are very, very frail when going into hospital, and of course they're coming out and needing residential or nursing care. So, you know, we would hope that position will start to improve and abate over time, but I suspect that probably certainly for this year we are going to see more of that type of need. But then obviously as services are restarted, that should reduce as a factor.
Thank you, Adrian. Just one other point about learning disabilities. I mean, there needs to be quite a huge increase there, nearly 3 million, isn't there? So again, is that for that same reason, because care is needed?
It is very similar. So I think certainly in learning disabilities, one of the key issues that we've had has been that essentially families just haven't been able to continue with their caring role all the way through the pandemic. So we have seen an increase in the number of people moving from essentially family settings being looked after with some support from local authority by their family into supported living schemes. And again, some of those people have quite significant levels of need. So the cost of the care per week is comparatively high to what we have seen before. We are discussing supported living more generally later this week to talk around what we need to do from a commissioning perspective to try and reduce those unit costs into the future.
Thank you, Adrian, and good luck. Thank you.
Thank you.
Any other member? Councillor Hatfield.
Well, I was just going to say I fully understand just how challenging it is. Certainly working in local government, you know, we've seen firsthand the massive increase, not just this year, but actually over the last 3 or 4 years, in people presenting with more complex needs, with more multiple needs, particularly with mental health. And working in a housing scenario, we're constantly pushing people who can't manage in temporary accommodation onto adult social services and adding to their cost pressures, because there's definite growth in need and vulnerability. I don't know what's causing that growth. COVID clearly is part of it, but there's also a wider trend in society where these needs are getting more severe, mental health, autism, a whole range of things, both physical health and mental health. And I really do worry that it is going to be really difficult without extra funding for adult social care to recognise actually the challenges that London councils, but all councils, but London in particular, are facing in terms of the people who are coming through the door and the additional support they need, be it supported housing or be it floating support or residential. And I hope it gets pulled in, but I do worry that we're going to have to make very difficult choices over this year as to who we support and how we manage those who don't meet the need for acute services without them failing and actually their condition getting worse because that support isn't there.
I suppose by way of comment, I completely agree, Councillor Hatfield, and I do think one of the biggest challenges we have is essentially how we maintain some earlier intervention work, so that essentially we don't just become a service for meeting people at the point of crisis, because we know in the long term that will absolutely be more expensive than our current level of spend. But unfortunately, that early intervention service is the type of thing that gets squeezed when you have to essentially meet your statutory responsibilities, and that is, I think, going to be one of the increasing challenges we have, as I said, over the next couple of years.
Thank you. Any other member? It is worrying how much of a deficit COVID and other issues have played in this directorate. So it's going to be quite challenging and difficult. It's just quite scary, really. Can we agree to note the report and comments and commend Adrian and his team on the the work that they're doing. It is hard, but well done to the team. Agenda item 11. Now, we have a list of future dates. Then obviously the next date of the meeting is scheduled for the 18th of October. We've got other potential business agenda items for this current year, which members might want to take on board and consider. And if there's other things that they'd like to add, perhaps they could email myself and Kelvinder. And also the potential visits. Ideally, if I may make a plea, that could we try and schedule the meeting visits this year as opposed to spring? If for any reason we need to postpone them to early next year, that's absolutely fine. But if we can try and schedule those in towards the end of this year, so that if they need to be suspended or postponed, we can look to early next year. But I would like to get some visits in to inform our understanding and support the work that we're as Scrutiny that we're doing, so that we can be better informed. Any member on what I've suggested? Is that agreed?
It's agreed, Chair. Yeah.
Okay, thank you. There's no other agenda items, so we don't need to exclude members of the public. So can I thank you all for your contribution today? It's been a very useful meeting. So, and just leaves me to say good night and thank you very much for all attending. Thank you. Good night.
Good night. Thank you.
Good night. Thank you, Debbie.
Good evening.
Night.
Bye.